An acute diagnostic reaction after treatment with metoclopramide. Definition: dystonia is a movement disorder characterized by involuntary, sustained muscle contraction that results in twisting and repetitive movement or abnormal postures. Metoclopramide is a dopamine receptor antagonist that blocks both D1 and D2 receptors in the central nervous system.
Hello, I'm Dr. Scott McKay, a veterinarian with Drs. Foster and Smith. Metoclopramide is a medication used to treat vomiting and acid reflux. It is also used to help control the side effects of chemotherapy, such as vomiting. Metoclopramide is effective in dogs and many other animal species. Metoclopramide is taken by mouth as a tablet. Always make sure there is plenty of fresh water available. The most common side effect with this medication is constipation. In addition, your pet may experience behavioral changes such as disorientation or frenzy. Metoclopramide may help control the vomiting, but the underlying cause of the vomiting must be addressed and treated. Do not use metoclopramide in an animal who is hypersensitive to this medication, has a stomach or intestinal blockage, or bleeding into the stomach. Do not use this medication in a pet with a history of seizures. For complete details on this medication, please examine the patient information sheet found on the product page. Always follow the dosage instructions provided by your veterinarian. And as always, if you have any questions regarding your pet's medication or observe any abnormal activity in your pet while on this medication, please contact your veterinarian.
Pros. Metoclopramide is used primarily in the following situations: as an antiemetic agent on R, as a prokinetic agent for the treatment of gastroparesis, and post-pyloric placement of general feeding tubes. Cons. Metoclopramide may cause extrapyramidal symptoms that generally manifest as acute dystonic reaction within the initial 24-48 hours of use.
FDA is requiring that the manufacturers of metoclopramide add a boxed warning to the label about the risk of tardive dyskinesia if the drug is used for long periods of time or at high doses. Metoclopramide stimulates motility in the upper GI tract. Its uses include diabetic gastroparesis and gastroesophageal reflux disease.
Tardive dyskinesia is characterized by involuntary, repetitive movements of extremities, as well as grimacing, rapid blinking, and impaired movement of the fingers. The risk of tardive dyskinesia associated with metoclopramide is increased among long-term users of the drug and also among elderly patients, especially women. There is no known treatment, and the symptoms, which are rarely reversible, may persist even after the metoclopramide is discontinued. However, in some patients, the symptoms may lessen or resolve when the drug is stopped.
FDA's advice to practitioners is to avoid the chronic use of metoclopramide, except in rare cases where they believe the benefit outweighs the risk. FDA is requiring manufacturers of the drug to develop a medication guide explaining the risks, and that will be provided to patients with each prescription.
Classification by etiology separates the spectrum of dystonia into primary and secondary categories. Secondary dystonia is associated with a known acquired cause or additional neurologic signs. Acute dystonic reactions, the most common type of extrapyramidal symptom associated with the metoclopramide, occurs in approximately 0.2% of patients treated with 30 to 40 milligrams per day.
Ojed, emergency physician and founder of edxitvideo.com. This video is about dystonic reaction. A dystonic reaction is an unusual reaction to a group of medications called neuroleptics. These medications are used for a few different reasons, including the treatment of psychiatric disorders, vomiting, and gastroparesis. Some medications that can cause dystonic reactions include the antipsychotics like thorazine, Mellaril, stelazine, prolixin, Navain, and Haldol. Also, anti-nausea medicines like Phenergan, Compasine, Reglan, and Droperidol can cause dystonic reactions. If you were diagnosed with a dystonic reaction, have any of the following symptoms, please stop the video and come back to the emergency department. If the reaction returns or becomes worse, if you have any persistent difficulty with swallowing or any difficulty breathing, if there are any significant new symptoms that weren't there when we first saw you, come back for reevaluation. The most common symptom of a dystonic reaction are muscle spasms of the face, neck, tongue, and back. The treatment of a dystonic reaction includes medications like Benadryl and or Cogentin. In most cases, the reaction can be stopped very quickly with the use of one of these medications. Sometimes the reaction can happen again over the next few days, even if the medication that caused the reaction was stopped. Your doctor wants you to continue the use of Benadryl or Cogentin for the next few days to keep the dystonic reaction from happening again.
Symptoms: involuntary limbs movement, torticollis, vulvar type of speech, dyspnea. The most rapid treatment of an acute dystonic reaction caused by metoclopramide is the intravenous or intramuscular administration of anticholinergics.
Oh, we will. We will. This handsome young man here is on a number of different medications, and if could you show me? Here's my student working with me. Mom doesn't want to be on the video.
Yeah, he's been on Respect and Depakote.
And Depakote. Okay, show me.
He was recently started on the benztropine today.
Okay, so he started on the benztropine, but the medication that he has been on is what?
He's on the Risperdal shot.
So he gets a shot how often?
Twice a week.
Twice a week.
I'm sorry, every 2 weeks. I apologize.
All right, so what's happened? So every 2 weeks he gets this Risperdal
Yes.
shot.
He received the shot on September 7th.
Okay. I'll be back in about 5 minutes and we'll see how you're doing. All right. Hopefully this will do the trick. I didn't even walk out of the room
It's
yet.
warming you. Oh,
It's feeling okay. So you're feeling kind of warm, but
Yeah, I'm feeling kind of
feeling kind of what?
happy.
Happy, okay. IV Benadryl apparently does have a little euphoric effect. Makes you feel good.
Conclusions. Doctors should be familiar with its bizarre side effects. Thank you.